evening, everyone. I am Dr. Anjum Qureshi, Assistant Professor from Rajiv Gandhi College of Engineering, Research and Technology, Chandrapur, India. Firstly, I would like to thank Global Edu-Conclave 2022 for giving me an opportunity to speak on the topic Sustainable Development Goal number 3, Good Health and Well-being. Sustainable Development Goals, or the Global Goals, were adopted by United Nations in 2015 as a universal call to ensure peace and prosperity for everyone in the world by 2030. The Sustainable Development Goal number 3 ensures good health for everyone and promotes well-being. Our health issues and healthcare requirements vary according to our age, gender, climatic conditions, and geographical location. Some developing nations are struggling to handle issues like malnourishment, death of women during pregnancies and childbirth, death of newborn and below 5 years of age. On the other hand, there are many nations who are finding it hard to tackle healthcare issues like cancer, diabetes, mental health, and deaths due to road accidents. Now, coming to the targets of SDG 03. There are total 9 targets. The first target talks about mental mortality, in which it says that by 2030 it will reduce the global maternal mortality ratio to less than 70 per 1 lakh of live births. The second target talks about neonatal and child mortality, in which by 2030 it intends to end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality or at least as low as 12 per 1000 live births and under 5 mortality to at least as low as 25 per 1000 live births. The third target talks about infectious diseases, in which it says that by 2030 it will end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases and combat hepatitis, waterborne diseases, and other communicable diseases. The fourth target says that by 2030 it will reduce by one third premature mortality from non communicable diseases through prevention and treatment and promote mental health and well being. The fifth target talks about substance abuse, in which it says that it will strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. The sixth target talks about re- reducing the number of global deaths and injuries from road traffic accidents. The seventh target is regarding the sexual and reproductive health, in which intends to ensure universal access to sexual and reproductive health care services, including for family planning, information, and education, and integration of reproductive health into national strategies and programs. The eighth target is regarding the universal health coverage, in which it will achieve universal health coverage, including financial risk protection, access to quality essential health services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. The last and the ninth target, which talks about environmental health, which says by 2030 it will substantially reduce the number of deaths and illness from hazardous chemicals and air and water and soil pollution and contamination. Now, these are some of the means of implementation for the targets of SDG 03. The first one says that it will strengthen the implementation of the WHO Framework Convention on Tobacco Control in all countries. The second talks about the research and development of medicines and vaccines for the communicable and non communicable diseases that primarily affect developing countries. It will provide access to affordable, essential medicines and vaccines in accordance with the Doha Declaration on Trade-Related Aspects of Intellectual Property Rights, that is the TRIPS Agreement, and public health, which affirms the right of developing countries to the fullest use of the provisions in agreement on TRIPS regarding flexibilities to protect public health and in particular provide access to medicines for all. The third one talks about health financing and workforce, which will substantially increase health financing and the recruitment, development, training, and retention of the health workforce in developing countries, especially in the least developed countries and small island developing states. The fourth one talks about the emergency preparedness to strengthen the capacity of all countries, in the particularly developing countries, for early warning, risk reduction, and management of the national and the global health risks. These are the few challenges to the healthcare in India: lack of health awareness, lack of access to healthcare, crisis of human workforce in healthcare, healthcare is not equitable, and the fifth is a lack of accountability. And all these challenges can be solved by using education, and this is that we'll be seeing in the next few slides. Yes, coming to the first challenge, that is lack of awareness. A large proportion of Indian population is not aware about important issues regarding their own health. Like very few Indian women have awareness about breastfeeding and reproductive health. This is due to the low educational status and because less importance have been given for health in personal life and as well as in the education system. So there is a requirement to enhance awareness level among the people to improve the health because if we take the situation or the example of girls, the girls who know about menstrual health, sexual health, family planning, breastfeeding, nutrition can take care of the health and also of their family very well. So their education can help in increasing the awareness if this all health related factors are discussed in the basic education system. The second challenge is the lack of access. Access to healthcare is a complex concept for many Indians. It also includes availability, supply, and utilization of healthcare services. The urban population has a good access to the healthcare as compared to those living in the rural and remote areas or the ones at the adverse geographical locations like the mountains. Along with this, the social and the cultural domains also affect the access to the healthcare. Like, for example, in India, nearly a decade ago, feeding the newborn with the colostrum or taking the pregnant ladies to the hospitals for deliveries was considered to be a taboo. But now we have tried to overcome this in most of the areas. The villages or the rural areas suffer with lack of hospitals, which does not have basic facilities like beds, wards, toilets, drinking water, ambulance, testing labs, and modern equipment. Education can help to raise discussions. It can help to get rid of the stereotype beliefs. Education will help to analyze the barriers and find solutions for it. Educate people will be confident to raise voice against the system related issues. The third challenge is the crisis of human workforce. Lack of trained staff in healthcare sector and also the ones who render their services reasonably is seen in India because the number of healthcare professionals is very less and it is unevenly distributed. We can find many doctors, super specialized doctors in the urban areas, but the people from rural areas are dependent only on the healthcare staff available at the primary health center, which mostly lack trained staff. The people have to move to nearby cities for better treatment, but in emergency situations, it can be very dangerous. It can cost someone's life. So, more people should be encouraged to enter the courses related to healthcare to fill the vacant post in the health sector. More competent healthcare workers are required so that every person gets care and support from the healthcare worker. and this can be done only through education. We require doctors, especially female doctors are required. We require trained professionals for diagnosis tests, and all this can be done only through having education in the related field. More people should be encouraged to take education in the health sector, go for such courses, and the fees in these courses should be increased. The fourth one, and a very important one, is the unaffordable healthcare. Healthcare facilities are not affordable. The diagnosis and the treatment is very costly. It is beyond the reach of more than half of the Indian population. The private sector dominates healthcare sector in India. The medicines and treatment from the super specialty hospitals is not affordable. Some with the critical illness lose all their money in treatment. The healthcare services provided by public sector are unreliable and in different quality. The healthcare insurance and schemes for treatment has been introduced by government for the economically weaker sections, but these are not known by many of them. So, these schemes should reach each and every person of the country, and over that, the procedures should be easier and it should be free of corruption. It also requires consciousness of the cost needs. Wasteful and expenditure on unwanted tests should be avoided, and education is required to generate consciousness among the youth about the issues of economics of healthcare so that they will be able to address it. The fifth challenge is the lack of accountability. Being accountable means one should justify and take responsibilities of its activities. The healthcare professionals are responsible for a variety of people and constituencies. So the first step would be to identify the problems and its underlying causes. Ethics in healthcare has become a hotly discussed issue here. The communication skills and the humanity skills should be a part of the education system. The healthcare professionals require these skills very much, which can be brought into them through education, through proper education. And this should be in the list of skills to deal with the pressure of relationships with the clients, employers, government, and the family. Education, as I already said, can play a great role in achieving Sustainable Development Goal number 3. In the early childhood education, fun and play can be used to learn and manage emotions, feelings, and relationships. At the primary level, the learners can acquire knowledge about mental, emotional, sexual, and reproductive health. They can develop abilities to manage emotions and stress and request for help if required. It will promote respect and understanding for others. At the secondary education level, it can include learning about communicable and non-communicable diseases, importance of nutrition, effect of environmental factors, and lifestyle on health. At the higher education level, research and evaluation can help to analyze factors affecting health and disparity, to develop responsibility for personal health and well-being for themselves and also for others. The issues and challenges may differ, strategies and initiatives will differ, but the goal is the same: ensuring good health for everyone. Ensuring healthy lives and promoting well being at all ages is a requirement for sustainable development. The medical field has developed new treatments, new medicines, and advanced equipments for saving lives, but there is still a lot to be done. We need improved sanitation and hygiene. We need to provide more funding of health systems. We require more number of physicians and health workers so that a significant progress can be made to save millions of lives. With this, I come to the end of the session and thank you one and all for your patient listening.